to not only RSIs but any injury. And whether your job is specifically as a WCB advocate for within your union, for example, or not, I know that there are many unions that have staff that assist workers with WCB claims, whether that is kind of their full-time or official job or not, or different union reps. And I know that there are a couple of unions, including MNU. We see we have Bernice here, and NGU, that have staff specifically dedicated to helping workers with WCB claims. So again, I just want to walk you through the resource guide itself. Is a very long, dense kind of resource, and you'll be happy to know I'm not going to kind of go through all of it. I'm just going to touch on some of the high points, and I'm also just going to sort of mention what I think at least are some of the key issues, I guess, that would occur to me at least if I were looking through this guide and thinking about repetitive strain injuries. What are some of the sort of key issues that might come up within that process and looking at that? So I want to say, by the way, just for people who don't know, that the Manitoba Federation of Labour is where I work. It's an umbrella organization for many of the province's unions in the public and private sector. I think we have over nearly 40 affiliates now from across the public and private sector, representing tens of thousands of workers. We do advocacy on behalf of our affiliates, government lobbying. We represent labor on various government bodies. And again, we produce resources like the Advocates Guide to support unions and labor advocates out there and going about their work. So that's what we do. And I just, for those of you who may want to access the guide later, I'll just show you. If you go to the MFL website, it's pretty easy to find. You just go to, hope you can hear me okay. You just go to Policy and Research, and you go down to Workers' Compensation, and yeah, you'll see it right there. And like I said, it's a fairly long guide. And I'm not going to download it right now, but that's essentially where you'll find it anyways, if you want to access it later. And so one of the things that the resource guide does is it sets out the roles, for example, for all the key roles of the people and parties that will be involved in the claim process. Adjudicators at the WCB, case managers at the WCB, review officers, which I'll say more about in a second, voc rehab consultants, return to work consultants, all of these WCB staff that will be involved in a worker's claim. Sometimes if this is a very short-term claim, obviously not all these people are going to be involved, but if it turns out to be a longer-term claim or a more complex claim, these are some of the key people that are going to be involved in it, again, at the WCB. So, sorry, did I skip the slide? Yeah. So, again, others that are potentially involved, and these are the kind of people that tend to get involved when things are not going well for the worker. The review office is the kind of internal body at the WCB that will, that's sort of tasked with, though they're internal, they do have a kind of an oversight role and sort of an informal appeal body for decisions that are made at the WCB. These are WCB staff, and they're one of the channels again that a worker or their advocate would go to attempt to get a decision overturned. From there, it would go possibly to the External Appeal Commission. This is a quasi-judicial body, as many of you will know, of worker and employer reps, public interest reps, and sometimes the Appeal Commission will call on medical experts to provide different kinds of advice. The WCB healthcare consultants, how many people are familiar with this role and these folks? So the WCB has on contract 30 plus medical professionals, physicians, psychiatrists, various other kinds of specialists, that case managers and others are can access if there is some confusion about the medical. I'm sure you're all too familiar with these processes that case managers and others can access if If, for example, the information they get from the physician, they feel it's not solid enough or not clear enough to make a decision, they will go to these healthcare consultants. These WCB healthcare consultants have been a source of conflict and controversy for many years. Increasingly so, I think, in the last 10 or 15 years. Because essentially what happens is this is not to disparage any of the individuals, but I think that what happens is you have a large team of medical professionals that are physically embedded at the WCB building. They're on contract to the WCB, and so whether they're involved in an actual conflict or not, it's a recipe for the appearance of a conflict. And it really, in our view, undermines the objectivity and transparency of the system. Manitoba is pretty unique in having not only such a large number of healthcare consultants, but also having them physically within the building. And we have been advocating for many years for the elimination of this system and for the establishment of a truly independent system where and we've been making a little bit of progress on that, slowly but surely. The other thing that happens oftentimes is that healthcare consultants will make decisions about claims, including, for example, whether the worker is ready to return to work physically. And I see Bernice nodding her head because she, I'm sure, is all too familiar with this issue. They will often make decisions about claims just based on a file review. But they won't see the worker. And what they do is they say, well, for this type of injury should be recovered within, let me see here, 6 weeks. So time for that person to go back to work. Now they're not making the decision, they're advising the case manager. But of course the case manager is unlikely to disagree with the physician. So you get this kind of culture that builds up over time. Anyway, I don't want to harp too much on that, but it is one of our favorite topics. And I see Sandy nodding his head as well. There's also the Fair Practices Office at the WCB that looks into complaints. It's sort of like an ombudsperson sort of role that they have. The Worker Advisor Office, which was mentioned earlier, but that's within the Department of Labor, and they provide free service to workers who are looking for help with an appeal process or with an adverse decision on their claim, and they can also be very helpful. And obviously our friends at the MFL Occupational Health Center, including Rob, who you'll hear from in a little while. So again, these are some of the key parties that might be involved in your claim. The guide also sort of goes through the claim process, you know, the whole sort of reporting and filing, the principles of adjudication, the principles around return to work, your entitlements and so on. And as was mentioned again earlier, the claim process can be confusing, and it must be especially so for somebody whose first language is not English, I can only imagine. Negotiating that system, and particularly if you're in a non-unionized workplace, you don't have access to resources to help you with that, it can be a very daunting process. And again, the different levels of appeal, which I already mentioned, there's a couple of internal levels, reconsiderations within the WCB, and then going on to the External Appeal Commission. By the way, always encourage anybody who wants to know about the kinds of issues that come up in claims and wants to learn more about what some of the key issues that often come up. The best resource in my view that you can look at is the public decisions. All the decisions of the Appeal Commission are public. They're all online. They don't identify the parties, obviously, but you can go in there. If you went in there right now and entered the search terms, repetitive strain injury, you would get literally hundreds and hundreds of cases over the last 20, 25 years online where workers have appealed claims and the Appeal Commission has sometimes sided with the worker, sometimes not sided with the worker. You will also see in there, by the way, that in many, many of these cases, it's about the medical evidence and it's about the decision, the opinion of the worker's treating physician versus that of the internal WCB healthcare provider is what's often at stake, especially when it comes to injuries like repetitive strain injuries where the cause, the diagnosis, the recovery time, whether the person's even actually recovered is, not as objectively as it is in, for example, a fracture or those types of injuries. So I encourage anybody who wants to know more about the WCB system, where it goes wrong and where it goes right, to spend some time poking around on the site of the Appeal Commission. The guide also talks about the roles and qualities of the advocate. I won't go too much into this. Obviously, it's about getting authorization from the worker if you're going to be their advocate, keeping them informed and so on, knowing your own limitations, knowing what's possible and what isn't within the system, all of the essential skills, record keeping. Anybody here who's ever worked as a union representative or in many of our jobs, we all know the importance of document. And the same is true of whether you're an injured worker that is filing a claim or a union support person or anybody else that's helping the worker. That documentation is absolutely crucial. I just want to quickly mention a couple of things. I don't see Lisa putting up her warning sign yet. I just want to quickly mention a couple of things. When we look through the Workers' Compensation Act, which is coming up for review this year, by the way, I looked at a couple of clauses of the Act and I thought, how would you interpret this clause in the context of a repetitive strain injury? The WCB, for reasons that escape us, insists on using the term accident. I don't know why. I don't know why they just don't talk about injury, as most other jurisdictions do. We at the MFL don't use the term accident because we think it implies that something is unpredictable and unpreventable. If you think about a repetitive strain injury, there's nothing unpredictable about it. It's the inevitable outcome of the process. How is this an accident? The same is true of many other types of injuries, so we don't use it. But in any case, an accident, these are the three kinds of accidents that can happen. Is an RSI a chance event? No. Is it? I don't think so, eh? Is it the act of another person that's not the act of the worker? Not really, unless it's your supervisor forcing you to do something that's ultimately going to harm you. If it's anything, it's this third type of thing, right? It's an event or condition related to the workers that results in a personal injury, including a disease. And this other language here is basically about how the WCB builds defense around mental health injuries. Traumatic stress disorder and acute reaction to a traumatic event. We don't need to go into that here, except to say that when you look at the definition of accident in the context of a repetitive strain injury, the only area where I see it would fit, obviously, is under C there. Now, adjudication standards at the WCB, there's basically, there's three types of standards, really. Most injuries, including repetitive strain injuries, are based on the balance of probabilities. Is it more likely than not that this accident happened at work in the course of employment? Which in some cases is pretty simple, You got your arm cut off in the bandsaw. Looks like it's pretty likely that happened at work. 10 people saw you. An RSI, it's a little trickier, at least from the WCB's perspective. Did this injury happen at work? And we heard a story earlier, a very compelling story about where that was, I think, one of the issues that was at stake, right? Did this spinal injury or did this forearm injury or what have you happen? Is it more likely than not that it happened at work? What other things were you doing? Did you have a pre-existing condition? And unfortunately, sometimes employers and others will go on a bit of a fishing expedition in your medical records to see if there could be another explanation for this. So when it comes to repetitive strain injuries, the short story is the balance of probabilities. It looks like a pretty simple principle until you start drilling down into it and saying, especially if you're attempting to deny a claim, you can find many ways to question whether something is more likely than not that it happened at work. The other adjudication principle, of course, is the dominant cause. We're the only province in Canada where if you have an occupational disease, like a cancer, for example, you have to prove as the worker that your work was not just a cause, but the dominant cause of the disease. Which, as you can imagine, with some diseases that can be caused by multiple things, becomes very problematic. Then we have what's called presumptive coverage for, sorry, I didn't put a slide on it here, I don't think. We have something called presumptive coverage for different types of diseases, firefighter cancers, and various other kinds of diseases now under our regulation, cancers related to asbestos and so on, where if you performed a certain process and you have this disease, it's presumed that the work caused it. By the way, there are some jurisdictions where certain musculoskeletal injuries, including repetitive strain injuries, actually have presumptive coverage. Okay? You've been doing this for X number of hours every day for 3 years. We're going to presume that's what caused your injury. You don't have to prove it. That makes sense? Look at a few people looking. So that's what we call presumptive coverage. The onus is not on the worker to prove the connection. The onus is on the WCB, if they want to try and disprove it. So just one final comment. Again, when I was looking at the principle of out of and in the course of employment, sometimes, as I said, it's pretty simple. You cut your arm off in the bandsaw. It happened at work. It happened in the course of your employment. It's less simple, I think, when it comes to things like different musculoskeletal injuries, soft tissue injuries, including repetitive strain injuries. You go and report a repetitive strain injury, or maybe you don't know that's what it is yet, but you report this injury to your supervisor or the WCB. When did it happen? Well, I felt the pain. How long have you been feeling the pain for 3 weeks? Did it get worse today? No. Well, when did it happen then? Right? The WCB wants to know when things happened, right? Which is simple with some cases, not so with others. With occupational diseases, there are special provisions around the timing. It's when you became disabled. But with RSIs, the question of when it happened can get pretty tricky. So people would say, were you feeling the pain 4 months ago? Yeah. Well, what were you doing then? I don't remember. Well, how do you know what happened at work? So you get the timing can be very problematic. Pre-existing conditions is another one to be very careful of when it comes to RSIs and claim management. Did you have a condition before? Was it made worse by this? Is it really the pre-existing condition that's bothering you now? How's it interacting with the work condition? Which has a lot to do with how they actually compensate you, based on, we're going to compensate you X amount for the work injury and X amount because it's impacting your pre-existing condition. So that gets very complicated when it comes to RSIs. And again, I highly recommend going and looking at the resource guide for worker advocates on the Manitoba Federation of Labour website. And if you don't have any plans Saturday night, go on to the Appeal Commission website and spend a few hours poking around there. You'll learn a lot. I see Thomas waiting in the back. Yeah, he's. Thank you very much.